This executive order doesn't mention schools, but if your child relies on Medicaid, mental health services, or behavioral support in school, this will hit them first. And it ties directly into the school to prison pipeline. If you don't know me already, hi, my name is Ria. I'm an educational advocate helping you to stay informed and empowered through my series on the Department of Education. So if that's something that interests you, be sure you're following along. We're on part 30. Let's connect the dots here. This new executive order pushes for institutionalization, civil commitment, and criminalization of people with mental health needs, especially those who are unhoused or seen as unable to care for themselves. At the same time, we're seeing proposed Medicaid cuts at the federal level. But why does that matter? Because Medicaid is one of the primary funders of school-based mental health and behavioral services, especially for students with IEPs and 504 plans. If Medicaid is cut or restricted, evaluations get delayed, counseling gets reduced, school-based therapists and support staff disappear, behavioral escalation goes unaddressed, and when students, especially those in already marginalized communities, don't get the support they need, they get punished instead of getting help. That's how the school to prison pipeline works. Now layer in this new executive order, which encourages the civil commitment of people who are unable to care for themselves. It also encourages data sharing with law enforcement and more policing with fewer harm reduction supports. Suddenly, something that started in the classroom ends up in the courtroom. Executive order isn't just about homelessness or addiction. It's about how we treat vulnerable people, including children with disabilities. If you're the parent of a child with an IEP, a 504, or a behavior plan, this is something you need to pay attention to. I'll keep breaking this down and sharing what you need to know, so be sure you're following along.